I'm Dr. Thomas Cheslik. I grew up in Youngstown, Ohio. I did my undergraduate training at Ohio State, did my medical school and residency at Wright State University in Dayton, Ohio. I then did a fellowship in adult reconstruction, which was a year spent just on advanced hip and knee replacement surgery in Orlando, Florida at Orlando Health. And then I decided to move back here, close to family in Northeast Ohio, to join OrthoUnited. I think what makes this place unique in Northeast Ohio, unique in general, is the focus on family values. I think people here really care about family and taking care of one another, and the community in general is very supportive, and I think that's something that's very unique and special and why I like being here. When you choose OrthoUnited, you're getting an individualized treatment plan. As a independent private practice, we're able to provide you with a plan of care that is personalized to you specifically. We have the ability to do physical therapy, get advanced imaging such as an MRI, and even do surgery on site. And we coordinate closely with the physical therapists, surgical staff, and office staff to make sure you have the best experience possible. By having everything in one location, it also allows us to monitor you more closely and also stay involved and up to date with your treatment plan and your recovery. If and when you decide on a total joint surgery, a joint replacement, there's a pretty standardized process that we have put together here to make sure everything's optimized to give you the best outcome possible. So after you come in and see one of the surgeons and are evaluated and it's deemed that you are appropriate candidate for a joint replacement, we go through a series of different tests and classes to get you ready for surgery. So we have a total joints class where you meet with some of our instructors, and you see our physical therapist for a prehab to get you ready from a physical and mental standpoint on what to expect from surgery and what to expect from the recovery process. We get some screening blood work and clearances from your medical doctor to make sure that there's no underlying medical conditions that we're unaware of that could be addressed or optimized prior to surgery, which will help lead to better outcomes if they were addressed first. And then we meet you back again to finalize a plan, answer any questions, and make sure everything's good to go before the day of surgery. Here at OrthoUnited, we do have a wide range of orthopedic subspecialists, ranging from things such as joint replacement to sports medicine to spine surgery and foot and ankle surgery, upper extremity specialists. So we really can take care of pretty much all of the problems that you would have from an orthopedic surgery standpoint. If there's a problem that I see a patient and that it's something I don't take care of or I don't address, I communicate with my partners and refer the patient to the appropriate surgeon where they could be evaluated and get treated appropriately and in an efficient and timely manner, so that we can take care of all your needs in one place. Physical therapy is critical after total joint replacement, particularly after knee replacement from my standpoint. Getting your strength and range of motion back is paramount for the long-term function of your joint, and being able to work closely with a physical therapist here gives our patients the best opportunity to have a successful rehab process. It's one of those things that having someone know your protocols and what you want out of a rehab process is really important and really beneficial to make sure our patients meet all of the goals and endpoints that we're shooting for. I think the surgery center experience here is really nice for patients. We have a dedicated team of staff who only works with orthopedic patients, and that's all we do at our surgery center is orthopedic surgery. Everything is optimized and streamlined to provide efficient and excellent orthopedic care, and I think having the benefit of having the same people around all the time, it really does help ensure that we get reproducible, consistent, good outcomes for our patients. I think the most rewarding part about being a surgeon is seeing patients recover and improve. There's plenty of instances where you have patients who are unable to do some of their just standard daily activities, or even do things like play with their grandkids or spend time with family because they have such severe pain or limitations from their painful hip or knee. Again, what I enjoy most about doing this is seeing those people back and seeing them recover and see them get their life back and see them get their mobility back and be able to do things that they want to do without pain. OrthoUnited is a fairly large independent orthopedic practice here in Canton, Ohio. We have a wide range of orthopedic surgical subspecialists as well as some non-orthopedic specialists that specialize in things such as pain management that help us provide a fairly comprehensive. So OrthoUnited is a large independent practice here in Northeast Ohio in Canton. We have a wide range of specialists treating all different types of musculoskeletal pathologies and conditions. We're able to work together to provide comprehensive orthopedic care and provide care to all age groups ranging from young athletes all the way to older individuals, and we're able to luckily do that all here locally in Canton.